Okay, so next is the abducens. The abducens nerve is motor control for one muscle, the lateral rectus. The lateral rectus is the muscle that moves your eye to the side. Okay, so just this way. Not that I can do it with both eyes at the same time, but you know what I mean. It is also proprioceptive for that muscle. So it's exclusively motor. There's no mix here going on. The facial nerve, okay. Sensory wise, you get the sense of taste from the anterior 2/3 of the tongue, some sensory from the external ear, so the outside of your ear, and the palate, so the top of your mouth. Motor wise, this is going to be the muscle for facial expression, smiling, frowning, growling. It's also part of your throat, the posterior belly of the digastric and the stylohyaloid, and the middle ear. So in the middle ear, you actually have muscles that control how much movement happens in the ossicles and the bones in your ear. So that's part of that. It's not voluntary, but it's still motor. It's still part of the movement that is controlled. Parasympathetic wise, you've got the salivary glands and the lacrimal gland, your tear-producing gland, being controlled, as well as some of the glands in your nasal cavity. So a lot of times when the facial nerve is damaged, you have issues with producing saliva or making facial expressions because you literally have no way to communicate with the muscles that help you to do that. And again, it's proprioceptive for the muscle. You don't have to watch yourself in a mirror to know if you're smiling or you're frowning or anything like that. You know where things are and what they're doing. Again, the vestibulocochlear nerve. So in your inner ear, you have something that kind of looks like a snail shell or a cinnamon roll, and that is the cochlea, okay? This is basically the cinnamon roll cut in half, but it would be here. The vestibule is this kind of bulbous section here, and then these are the semicircular canals. So the vestibulocochlear nerve is bringing in information from the semicircular canals in the vestibule, as well as the cochlea. And when they fuse together, the vestibular nerve and the cochlear nerve, we call them the vestibulocochlear nerve, which is right there, okay? This does double duty. I know you guys probably think ear, hearing, which is true, but also in your ear is your sense of balance. So whether that is balance being pulled on by gravity, which way is gravity yanking on you? Is it pulling at your feet? Is it pulling you forward? Is it pulling you back? As well as movement. So if I were to do a cartwheel, my head would do this very significant movement, right? So that movement is actually caught by the semicircular canals. So balance is part of what your ear does for you. That's one of the reasons why when people get ear infections, they tend to have issues with balance. They get dizzy. All right, the glossopharyngeal nerve. So the glossopharyngeal nerve back there is actually sensory for the sense of taste on the back of your tongue, the posterior 1/3. It's also sensory for your throat. So your pharynx, your palatine tonsils, some of your middle ear, the carotid sinus and the carotid body, which are in your chest. Motor-wise, it's the pharyngeal muscles. These are the muscles in the back of your nose, the back of your mouth, and the upper part of your throat. So it's involved in things like swallowing, okay? Parasympathetic-wise, again, salivary glands. So when this is damaged, not only do you have issues with swallowing, but you also have issues with producing saliva because those salivary glands are not getting the signal saying you need to release saliva, okay? The vagus nerve, which is back here. The vagus nerve is very extensive. So just to give you an idea, vagus nerve. Whenever I mention the vagus nerve, I always say it's busy like Vegas because look, okay? So sensory-wise, it's going to be the bottom of your pharynx, the larynx, which is your voice box, thoracic and abdominal organs. So your heart, your lungs, your stomach, your liver, your gallbladder, your spleen, your kidneys, your intestines, all of that. Motor wise, we're talking about the soft palate where your uvula is in the back of your mouth, the pharynx, again, the swallowing thing, the intrinsic laryngeal muscles. So those muscles that actually allow you to change your voice and give it inflection when you're speaking. And the extrinsic tongue muscles, the ones that allow you to stick your tongue out and go side to side, not to change the shape, but actually physically move your tongue in and out and side to side in your mouth. And it's proprioceptive for those muscles, tells you where they are. Parasympathetic, well, if it's involved with your heart, your lungs, your intestines, your liver, your stomach, all of that, that's going to be parasympathetic. That's going to be autonomic. It's not going to be something that you control. So it's parasympathetic. People usually know that there's something wrong with the vagus nerve because people have issues controlling their voice. So they almost have a hoarse sounding voice, like they're trying to talk and it's just not working right. Now, laryngitis does not mean that you've got vagus nerve damage. This is bigger than that because on top of that, there will be other things. It's not just going to be that you're hoarse. Probably after today, me doing as many lectures as I'm trying to get done in one day, my voice is going to be hoarse, but it's not because I have vagus nerve damage. Okay, the accessory nerve, it is exclusively motor, okay? And it's to two separate muscles. It's to the sternocleidomastoid and to the trapezius. So trapezius helps you to kind of lift your shoulder blades. The sternocleidomastoid pulls and allows you to pivot your head side to side. So depending on which side, because remember, all of these nerves that I've been talking about, we have two. We've got a right and a left. So technically we've got 24, but we've got 12 pairs. So if you damage the accessory nerve, let's say on the right side, then you're probably going to have issues lifting your shoulder and turning your head to the right. If you damage the one on your left, vice versa. But normally, if you've got damage to one and not the other still works. It's not like you lose both. Okay? And finally, the last cranial nerve is the hypoglossal. The hypoglossal is motor, and it's to the intrinsic and extrinsic tongue muscles. So intrinsic are the ones that actually allow you to change the shape of your tongue when you're chewing, when you're swallowing, when you're making words, when you're speaking, and you have to make certain sounds. Your tongue has to be a certain shape in order for that to be accomplished. So not only are we talking about in and out and side to side, now we're talking about manipulating the shape of the tongue for intrinsic tongue muscles. The throat muscles as well, and it's proprioceptive for those. We pretty much know where our tongue is. If I tell you to close your eyes and stick out your tongue or move it to the left or move it to the right, you usually do. Now, when damage happens with this particular cranial nerve, a lot of times people have issues sticking their tongue out. Like they can't do it correctly because that control that they normally have isn't as good as it normally should be. So a lot of times they are alerted that something's wrong when the tongue won't move the right way. And that is the end of the brain and the cranial nerves. So for this practical, you are going to have to know the neuron, all its parts and pieces. You're going to have to know the Schwann cell, all its parts and pieces. You're going to have to know the neuron models, the spinal cord, the spinal nerves, the brain, the cranial nerves, all parts and pieces. Okay? So if you have any questions, don't hesitate to contact me.